Hi, welcome to the chapter 9. Okay, let's start. 9. Hospitals. A. Introduction to a hospital. Jordi Pons is a 4-year medical student from Barcelona. He has contributed on a elective attachment to the Royal Infirmary Edinburgh. Dr. Baron is introducing him to the hospital. Dr. Baron says, the Royal Infirmary is the name of the University Hospital for Edinburgh. University is a general hospital dealing with all types of patients and illnesses, except pediatrics. We have a specialist hospital for that in another part of Edinburgh, the Hospital for Sick Children. You can see some of the departments in our hospital on the scene, of course. There are many others, for example, the intensive care unit and the surgical high dependency unit. Jordi, what does outpatient means? He say. Dr. Baron says outpatients are the people who come to the hospital to attend a clinic or to have tests or treatment and then return home on the same day. In patients staying in the hospital for 1 or more days, the rooms where they stay are called wards. If a patient's treatment requires only 1 day, such a simple operation, they can be admitted to the day of the surgery unit. Today's surgery unit. So we're gonna be reading this score there. Welcome to the Royal Infirmary. South entrance. Car parks CED visitor staff. The Simpson Center for Reproductive Health. Gynecology emergency. Maternity emergency. And neonatology is an emergency. Outpatient departments, all wards, the surgery unit, and endoscopy, X-ray department, and convene assessment. B. Outpatients. Dr. Baron, the accident and emergency department, also called casualty, is where the patients who are acutely ill with a certain serious condition come for assessment and treatment. Outpatients who has an appointment to see a specialist go to a clinic in one of the outpatient departments. They have usually been referred to the hospital by their GP, who writes a referral letter to the consultant explaining the patient's problem. C. Inpatient. Dr. Baron. The inpatient in a hospital are admitted in one of their main ways. They may be seen one of the outpatient clinics and admitted from there, or if there is a lot of demand for the treatment they need, as in the case of a hip replacement, they are put on a waiting list for admission. Alternatively, their GP may arrange the admissions by telephone because they are acutely ill, for example, with suspected myocardial infarction, or they are seen in the A&E department, where the doctor on duty working at that time arranged the admissions. This will happen in the case of the patient with a fractured neck. Oh my God. Or femur, for example, larger hospital may have an assessment unit where patients can be admitted temporarily while their condition is assessed. Jordi, assessed? Dr. Baron, yes, decisions are made about their condition and what needs to be done to help them. After treatment is complete, the patient is discharged to the GP care. Okay, perfect. So we're gonna be translating into Spanish. Ok, 9. Hospitales. Introducción a un hospital. Jordi Pons es un estudiante de medicina de cuarto año de Barcelona. Ha llegado a Edimburgo en una pasantía electiva en el Royal Infirmary Edimburgo de Barro. El doctor Barro le presenta, lo introduce al hospital. Doctor Barron dice, el Royal Infirmary es el nombre del hospital universitario de la Universidad de Edimburgo. Es un hospital general que atiende todo tipo de pacientes y enfermedades, excepto el pediátrico. Tenemos un hospital especializado para eso en otra parte de Edimburgo, el Hospital para Niños Enfermos. Puedes ver algunos de los departamentos, you can see, o sea, puedes ver algunos de los departamentos de nuestro hospital en el letrero. Eh, por supuesto, Hay muchos otros, por ejemplo, en la unidad de cuidados intensivos y la unidad quirúrgica de alta dependencia. Jordi dice, ¿qué significa ambulatorio? El doctor Barro le responde, los pacientes ambulatorios son las personas que acuden al hospital para asistir a una clínica o para hacerse pruebas o tratamientos y luego regresan a casa el mismo día. Los pacientes hospitalizados permanecen en el hospital durante uno o más días. Las habitaciones donde permanecen se denominan salas. Si el tratamiento del paciente requiere solo un día, como una operación simple, puede ser ingresado en la sala de cirugía ambulatoria. Ok, ahora leer el cuadro. Aquí dice, bienvenidos a la Royal Infirmary, entrada sur. Eh, para aparcamientos, parqueos, CID, visitantes y personal. El Centro Simpson para la salud reproductiva. Ginecología en urgencias, maternidad en urgencias y neonatología urgencias. Departamentos de consulta externa, todas las salas, unidad de cirugía ambulatoria y endoscopía, departamento de rayos X y evaluación combinada. B. Pacientes ambulatorios. El departamento de accidentes y emergencias, también llamado urgencias, es donde los pacientes que están gravemente enfermos con una afección repentina y grave acuden para su evaluación y tratamiento. Los pacientes ambulatorios que tienen una cita con un especialista van a una clínica en uno de los departamentos de consultas externas. Por lo general, han sido derivados al hospital por su médico de cabecera, quien escribe una carta de derivación al especialista explicando el problema del paciente. Y por último, C, pacientes hospitalizados. Doctor Barro, los pacientes hospitalizados son admitidos de una de las tres maneras principales. Pueden ser atendidos en una de las clínicas ambulatorias y admitidos desde allí, o si hay mucha demanda para el ingreso o sin mucha demanda del tratamiento que necesiten, como el caso de un reemplazo de cadera, se les pone en una lista de espera para el ingreso. Alternativamente, su médico de cabecera puede organizar el ingreso por teléfono porque están gravemente enfermos, por ejemplo, con una sospecha de infarto de miocardio, o son atendidos en el departamento de urgencias, donde el médico de guardia trabajando en ese momento organice el ingreso. Esto sucedería en el caso de un paciente con una fractura de cuello femoral. Por ejemplo, los hospitales más grandes pueden tener una unidad de evaluación donde los pacientes pueden ser evaluados, siendo ingresados temporalmente mientras se evalúa su condición. Jordi dice, ¿evaluados? Doctor Barro, sí, se toman decisiones sobre su condición y lo que se debe hacer para ayudarlos. Una vez completado el tratamiento, el paciente es dado de alta y regresa al cuidado del médico de cabecera. Okay, so let's gonna translate. Dijo, so we're gonna be running the exercises, only the exercises. Okay, and there. Okay. 9.1 complete the table with words from A, B, and C of positive. Put a check mark in front of the stressed syllable in each word. The first one has been done for you. So admit is admission. Assess is assessment. Discharge is discharge. Operate is operation. Refer is referral. And treat is treatment. You can see what did I put? The stretch mark in each case. 9.2. Make word combinations using a word from each box. Look at CO positive to help you. So acutely ill, assessment you need, on duty, referral letters, and waiting list. 9.3. Which hospital departments will be the most appropriate for the following patients? Look at A, B, and C of positive to help you. 1. A woman in diabetic coma is an intensive care unit. Intensive care unit. 2. A patient a patient who has you had a radical prostatectomy is high dependency unit. 3. A patient who is to have a skin lesion removed, it is day surgery unit. For a man with a foreign body in his eye is emergency. fight a woman with a threatening abortion is an accident in an emergency. 9.4. Complete the extract from an information leaflet for patient. Look at A, B, and C opposite to help you. Information for all patients. When you are at the hospital, please tell the receptionist who will welcome you, check your details, and direct you to the waiting area. The length of your visit depends on the treatment you're going to have. You may need to have some tests such as X-ray, which could mean going to another department, or maybe referred to other professionals such as physiotherapist or dietitian. You may need to revisit the clinic if staff at the clinic want to see you again. In another appointment will be arranged for you. If you need to be admitted to hospital for maltreatment, either as an inpatient or for a day surgery, you will be told when this is likely to happen. If you don't need further treatment, you will be discharged to you to your GP cares. Okay, thank you for your attention. See you next chapter.